Now, your health, your safety. This is ABC7 News.
Hi there, I'm Kristen Z. Let's welcome our new audience on ABC7. You've been watching, of course, our Getting Answers show that we come on every day at 3 o'clock right here to get answers with experts to the questions that you might have. So we're glad you're with us today. If you haven't posted your questions yet, please do so, because today we have our special correspondent, Dr. Alok Patel. So again, you can post those questions on Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. You know the drill. But first, this is a big day. As you know, California Stage 2 reopening can start today, according to the governor. So let's give you a look at what some major stores will look like when they reopen. This is video sent to us from Macy's looking at their curbside pickup, similar to what we see for restaurants. And look at that plexiglass, where the cashier is kind of behind that glass to have that barrier between them and the customers. That's how it might look like before they reopen. And look at the floor here. You see those dots on the floor for social distancing as you stand in line. And obviously, they're putting out a lot of education for customers, keeping their distance. And it looks like they're also going to have a lot of hand sanitizers and asking people not to shake hands, things like that. And they'll be cleaning and disinfecting frequently. So let's give you some reopening guidelines that the governor provided for retail. So for now, he's suggesting pickup or delivery only with physical distancing, hands-free payment, so Apple Pay, things like that, no exchanging of cash, certainly safer that way. Hand sanitizer available, we talked about that. Employees must have protective gear, meaning things like masks to begin with, maybe gloves. Employees getting training on COVID-19. And Napa, Sonoma counties say they're ready to do that today, along with Solano County and Santa Cruz County. But the other Bay Area counties say not yet, not ready to move into phase 2. And they're kind of giving May 18th as sort of like the new timeline for when that could happen. So a lot to discuss there with this impact to retail opening today in some limited scope. So today we're talking with the president of the California Retailers Association, Rachel Michelin. Thank you, Rachel, for joining us. And also on this panel, we have the owner of the Bow and Arrow Clothing Boutique in Sonoma County that will open not today, but tomorrow. Welcome to both of you.
Thank you.
Mercedes, let me start with you, because you've been closed for what, almost 2 months now?
Just about, yes.
So tomorrow's the big day. How are you feeling? A little nervous?
Yeah, I'm feeling very anxious. We've been prepping the shop today and making sure that we are taking the safety measures that are now required for retail shops. So we'll have our sanitization station ready. Employees will be wearing masks. And we're only allowing in-store pickup orders and online orders at the time.
Mm-hmm. How are you going to provide any sort of customer service, for example, if people had a question about a product?
Yeah, so as of right now, we do a lot of communicating via Instagram with our customers if they have any questions about sizing or ways to order. So that's definitely been a way we've been communicating with them right now, and via email as well.
Okay, and what kind of training have you given to the employees there?
So I will be actually working for at least this first week, kind of scoping out what business is going to be like. And I'm right now putting together a written plan for my employees of what kind of safety measures they need to take before I bring them back on board. But definitely during my time here, I will be wearing a mask, and we'll have our hand sanitizer handy as well upon entry for customers.
Mm-hmm.
So kind of see how the week goes.
Okay. Paula Hunter German is asking on Facebook. Actually, it's more of a statement. She just said, I would like to try on the clothes. That's a ways off, right?
Yeah, so that's definitely something I don't plan on allowing right now. What we will be doing is informing customers of how sizes run. I also will be doing like live Instagrams, modeling the clothes and showing customers the size run and how it looks.
Oh.
But we strictly want to just stick with doing in-store pickup and online orders at the moment.
Okay. Rachel, your group represents retailers, all different types. What do you think about this initial step, letting some non-essential retailers reopen with mainly curbside pickup? Do you think that's the right step? Do you think that's too much, too little?
So I think it's a great first step. We've been advocating for curbside pickup for retail for weeks. We believe that, similar to how restaurants were able to do to-go orders for food, we always thought that retailers should be able to do to-go orders for their products. But I think it's great. And I encourage all retailers to take advantage of the opportunity to do curbside. It's a great kind of first run at how things are going to look, how things are going to work once some of these new COVID-19 protocols are really put into place. But it's our hope that as we show governments, as we show local governments, the governor's office, how really seriously retailers are taking the safety of both their employees and particularly consumers, that we'll see some lightening of these restrictions. And our goal really is, we know the biggest impact to both the small businesses in California as well as to local governments. We just saw California is going to be facing a huge budget deficit. We know sales tax revenue. We know retail is a huge piece of that. And if we really are going to see ourselves getting out of this economic situation that we're in, it's going to be when we can really open the doors to the brick and mortar stores, retail establishments across the state.
Sure. I mean, already they were having a hard time competing with the internet-only outlets such as Amazon. So they've got some catching up to do, the brick and mortars. I want to bring in some viewer questions. Laura Albini wants to know, what about jewelry stores? Of course, they're not in this first wave that the governor outlined, right? We're talking about toy stores, clothing stores, bookstores, florists. What about jewelry stores? Rachel? Did you hear me okay, Rachel? No? Hi, Rachel. Can you hear me? Mercedes, are you with me? All right, we might be having some audio issues here. Are you folks back?
Sorry, it's having trouble there.
I couldn't quite. Yeah, I couldn't quite
Live
hear
television
you.
via Zoom, that's okay. It sounds like you guys are back. So I'm going to pose the question that a viewer is asking. What about jewelry store? Rachel, we know that the governor right now is saying bookstores, toy stores, clothing stores, florists. When do you think they might get to jewelry stores? And then what's in the next wave to reopen?
So I think what you asked was, what's the next wave to reopening? The governor, if you look at his kind of ordinance, what he put in terms of phase 2 that we're in right now with curbside, it really, our interpretation is that it's open to all types of retailers. To us, retail is very broad. I think different industries, like particularly jewelry, where you might want to try on a piece of jewelry, especially if you're making a significant investment, that's going to take a little bit more nuance in terms of how you're going to be able to do that. And, the first priority for anyone, particularly for small business owners, particularly for large retailers across the state, is the safety of consumers and their employees. And so you're going to see differences. You're going to see things like fitting rooms may not be open in stores. You may not be able to return items as quickly as possible. You may not be able to touch items. There's going to be some differences when it comes to the retail experience. But we're going to do everything we can to help all retailers figure out the right path for them to eventually open.
Yeah, I've also read about things such as maybe no public seating areas, right? Certainly no samples that people can try. But I want to ask you about this curbside only. In Solano County, the public health officer there is saying actually in the stores that are allowed to reopen, people can go inside if there is social distancing and safety measures to prevent everybody from crowding the curbside area, which they indicated could create problems, as well. What's your thought to that with regard to being able to go inside?
So I think you'll see, as we've talked about it, and our association put out guidelines and suggestions, and we've done that both to local and state officials as well as retailers across the state. We have had retail that has been open the entire time. We call them essential businesses. People were going into grocery stores. They were going into big box stores. We learned a lot. We got a lot of best practices from those stores being open. So I don't think we should fear people going into stores, because I think retailers up and down the state know the protocols. They're going to take those protocols. You're going to see the lines on the ground. You're going to see the social distancing. You're going to see the signs when you walk into stores. You're going to see the encouragement of wearing facial coverings. You're going to see employees wearing facial coverings. So I don't think we need to be that afraid of people going into the store. I think that the curbside is a great start. And I think you do have to start slow. But, you will see counties across the state that will be moving faster in terms of letting people in, both I think when it comes to retail and then restaurants, when we get those guidelines on Tuesday from the governor. I think there are some parts of the state that are really itching to really move a little bit faster through the phases.
Sure. Rachel, we're going to take a short break on the air right now, but let's continue this conversation over on our live stream platforms. I do want to explore what happens when you have different counties taking different actions. Be right back.
Sure.
All right. Eric, can we continue this conversation for a little bit? Rachel, I do want to ask you, what is the cautionary tale you have, I guess, for policymakers when you have counties that are not far away from each other that you can easily drive to that have sort of different rules?
It's going to be challenging. We saw this happening when we did the shutdown of the economy and when stores were closing. You saw different counties doing different ordinances. So a couple of things. One, it becomes very difficult for consumers and for businesses to know what they need to comply to. But number two, frankly, I think people who really want to go shopping or want to go to a restaurant or do an experience, they're going to go there. And, I think that counties really need to work with businesses. I think businesses are really wanting to work with their elected officials and public health officers on doing this safely. And, it would be great if all counties could kind of move at the same time. I think that would be extremely helpful, both from a perspective of their local economies, because they'll be able to benefit, but also from a state perspective. I believe California, especially from a retail perspective, with the amount of time and energy we have put in educating our members and retailers across the state, I think we're ready to do this safely. And I think at some point there needs to be that trust that we are able to do this together.
All right. Hey, Mercedes, is there anywhere you can show me in your store the changes that you've made?
I haven't got to that just yet. We've been busy putting out.
Gotcha. Yeah. I can imagine. All right, ladies, we're coming back on TV in about 10 seconds, so just hang on to that thought. All right, and we are back with the president of the California Retailers Association, Rachel Michelin, and the owner of the Bow and Arrow clothing boutique in Sonoma County that will open tomorrow for the first time since this pandemic began. Mercedes Hernandez, thank you both for continuing with us. Mercedes, I want to turn to you because right now you are not going to accept returns, right?
Yeah, so right now, we are being pretty strict with our returns, and I'm not sure when we will lift that new policy that we are going to be enforcing. So we're kind of waiting and just playing it week by week to see what that's going to look like.
And what other ways, you mentioned the Instagram where you can show the clothing and kind of give people an idea for the sizing. What other creative things are you considering that will still give people the confidence to buy? Yeah,
so we've been doing updates on our website as well. So uploading all the new arrivals on there, and even doing maybe a video footage on our website so that when a customer does click on a product, they're kind of able to see live footage of what the, say for instance, the top looks like in movement, and just to get a better idea of the style overall.
All right, those sound like great ideas, Rachel. I'm sure a lot of retailers are contemplating them. I want to ask you if you've sent out guidelines to your partners, your retailers, about how to ensure the safety of both the customer and the employee in their interactions. In our Macy's video, we saw that they're installing sort of these glass partitions. But what other things? Like, for example, can you document every interaction between a customer and employee? Like, who exactly made your latte or packed your order, things like that?
So we've sent out guidelines to our members and suggestions and best practices. And again, a lot of it's building on what we learned from our other members that have been open during this period of time. In terms of documenting, we really aren't recommending that at this point. We are recommending things like, we call them sneeze guards, which is the plastic, barriers between the two. Some stores you'll see that will be implementing that. I think you'll see that more in the larger chains, not so much in the smaller, but definitely face coverings. Signage is really important. reminding people to, on their public announcements and in their stores about social distancing, reminding people not necessarily to pick up and touch products, but kind of look with your eyes, not with your hands. Doing things like putting the markings on the ground to make sure. And then really the other piece of it is limiting the number of folks that are in your store at any given one time. So those are some of the things. Now it's always evolving. So we'll see how those work out. And then we'll continue to update that as we see what's working and what's not working. You know, down the road, will there be something like taking people's names and all that? I don't know. In California, we also have the privacy law. We have the strictest privacy law in the nation that starts being enforced in July. So we have some different privacy issues in California that pertain to businesses and consumers in other states. So there's a lot of moving parts right now that we're trying to work through. But first and foremost, it's really about the safety, because frankly, if retailers are not going to take the steps to ensure the safety of their consumers, the consumers aren't going to come back to the store.
They're not going to shop.
So we really need to make sure that happens.
All right, Rachel Michelin and Mercedes Hernandez, thank you both so much. I know the playbook, the rule book is kind of being written as we go. So we'll continue to have this conversation with you. Thanks so much.
Great. Thank you.
All right, we're going to take a short break on the air, and when we come back, we'll have Dr. Alok Patel joining us. But the conversation continues on our live stream platforms always right now. Oh, we have a choice. Okay. Rachel and Mercedes, you guys are still on. Rachel, I've got one more question for you, and that is, what is your sense for the percentage of businesses, the brick and mortars, that will actually be able to make it financially by taking these measures? Because when you say, let's say you got to cut your number of people in your restaurant, for example, in half, not a lot of businesses, or not every, can make money that way. So what are you thinking?
You know, I think we're going to take a hit. I think in the restaurant, just strictly restaurant industry, you're looking at probably 25 to 30% of restaurants won't make it through this crisis. I think on the retail side, you're going to see some losses. You're going to see particularly small retailers. That's why we've been advocating really hard for small retail. And while curbside is a really great idea, it's also a really difficult thing to implement if you didn't already have the infrastructure in place. That's why we really want to see more of opening of the stores and letting people come in under these strict guidelines. But I think, you know, if we kind of look at what restaurants are, I would venture a guess you'll see about a 30% drop in retail establishments in California as well.
All right, ladies, thank you so much. Mercedes, good luck to you. I hope you have a great reopening day tomorrow.
Thank you so much.
Thanks, Rachel. Take care.
Thank you.
All right, guys, when we come back, we're going to chat with Dr. Alok Patel, and he always has interesting and good information for us. So post your questions on Facebook right now, and I'll try to get them answered. Anything about new research, the first home test, you know, whatever your latest medical question might be with regard to COVID-19. All right, getting ready to come back. All right, there's a lot to talk about when it comes to COVID-19, and we know one doctor who we can depend on always, and that's our special correspondent, Dr. Alok Patel, joining us live back again on the 3 o'clock show. Dr. Patel, it's good to have you back.
Good to see you, Kristen, and you can depend on me.
We definitely can. And today, the question we want to start with is, as we start this reopening, right, this more retailers being able to open, what numbers would you say we need to look at super, super closely to make sure that we're not moving either too fast or too slow, or allowing this to blow up again?
Well, Kristen, first and foremost, the numbers that everyone's going to be paying attention to is the actual cases of COVID-19 and the deaths. And I do applaud Governor Newsom's office for actually laying out these clear kind of metrics they want to see. They want to see like less than 1 in 10,000, that ratio of new coronavirus cases in each county, and also no deaths for 14 days to make sure that we are hitting kind of a plateau and declining. But what's going further than that is kind of a protection if there were to be another surge in cases. So for example, they want to make sure there's adequate testing in all the counties for 75% of people that's available to them, and they have the means to actually get that testing. They want to make sure there's contact tracing in place. They also are going to look to make sure that every county that's reopening, their hospital systems can handle a surge, and that there's temporary housing for any homeless people. So I do respect the fact that not only are they paying attention to the metrics, they're paying attention to the entire thing, preventing and reacting.
Okay, we get a lot of questions here. Sally Costa wants to know, when can everybody get tested for antibodies?
Sally is asking the question right now that all of us would love to be able to say, you can get tested right now, but the fact is, you can get an antibody test. We just aren't going to be able to determine whether or not it's accurate, because right now, there's about a dozen or more FDA-approved serology or antibody tests. Now, they just recently announced a few days ago there was going to be a crackdown, and they were going to start reviewing some 150, 160 other tests on the market. Some of those are accurate, some aren't. So the short answer to your question is, if you need to get an antibody test because you feel like you've been exposed, you want to know your status, and you may need it to further kind of decide what your next move is, chat with your doctor and also look at the specific test. You need to really make sure that it's accurate, and if you have the means to, take it twice. But your best bet is to get an FDA-approved test so you can trust the results.
All right, Dr. Patel, the FDA just approved the first home saliva test for COVID-19. Can you talk about that?
The home saliva test works in the same way as that nasal swab test does, where what it's basically trying to do is test for the virus's genetic material. Now, we still are going to wait to see what the saliva test looks like in terms of all the data, its positive predictive value. Is it really accurate? Because one thing about the saliva test is you actually, when you're spitting, you actually are basically relying on the fact that that little piece of saliva has the virus's genetic material in it. Now, you could, for example, have COVID-19 and you may not be extracting the right sample. This can happen with the swab as well. And so that's one thing people need to pay attention to. But as far as an early test, getting it accessible to everyone and screening, this is a positive first step.
And I think that just sounds a lot more appealing to a lot of people than the current swab up the nose through the brain. Okay, I want to ask you about vaccines now.
Absolutely, and
right?
it's more accessible.
Yeah, and less painful.
You don't need it, and no one needs PPE to give it to you.
Exactly. Okay, so vaccine trials, there are a bunch going on. Moderna has reached phase 2, and they're saying they hope to get to phase 3 soon. Do you think we could see a real vaccine that works by the end of this year?
I'm cautiously optimistic. That's the phrase I use. If we were to see a vaccine come to fruition at the end of the year, it will break any record we've ever seen for a vaccine coming to market. I think the fastest one was 4 years. But as most experts have said, on average, vaccines take 10 to 20 years to develop. The reason this one is so much faster is just because of the process itself and so much collaboration. Now, Moderna is the same company that had the first trial back in March, if you remember, in Seattle. They just finished phase 2. I'm sorry, they just got approved to start phase 2, which will really start to look at safety, efficacy, meaning how well does the vaccine generate an immune response, and the dose. And Moderna is optimistic that they'll move to phase 3 in summer. But again, I think what's important for the public to understand is this is assuming everything goes perfectly right. We all want that to happen. We would love to see a vaccine, but I think it's realistic to expect that the vaccine may be delayed. Another company may get there first, or we may not see one for a year or even more. I think those are all possibilities right now. And if I could just add, one other thing that's exciting, some good news about the vaccines in process is they use a new technology called mRNA vaccine. Now, this has been around, but we've never seen a vaccine specifically doing this. If you were to imagine your DNA is a cookbook, mRNA is the specific recipe, and this vaccine would teach your body how to identify the proteins from the coronavirus to get immunity. So it is a very cool and promising technology.
All right, Dr. Patel, some weird audio issues, and we do apologize for that. Folks, we're going to take a short break on the air, but over on our live stream, we're going to talk to Dr. Patel about that yellow lemon pin. Be right back. All right, I think we're in commercial and we're still on Facebook. I'd be remiss not to ask you, because actually the question comes from one of my best friends. What is the story behind that lemon pin on your lapel?
One of the producers, Sabrina, asked me the same thing. She's like, what is with your pins? They always have to reflect what kind of mood I'm trying to project. So today, it's if life hands you lemons. Sounds kind of corny, but it is a pretty fly pin, and I needed to come up with a story. Ah,
okay, so there's no medical symbolism there. It's not like loading up on vitamin C's, things like that.
No.
Got it.
No, this is a more of a philosophical one.
Gotcha. Okay, Sabrina.
Find little moments of triumph. Find little moments of victory.
Okay, well, we kind of all need that right now, right? So that is good. Hey, has the CDC report showing any decrease in, well, somebody said vaccinations, but I don't think that's the word we're looking for. Do we mean showing a decrease today in cases? Is that what we're getting at maybe? I'm not sure I understand the question, but there's some CDC report. Do you know what I'm talking about?
I do. And so what the CDC basically did is they teamed up with the Vaccines for Children program, and they reported that from March to April, they had seen a large decrease in the amount of non-influenza and measles shots given out.
Oh,
so
I
it is
see.
fair
Right.
to
Okay,
say
so it's not COVID-19.
that there has been a decrease in the amount of vaccination.
I gotcha.
Not related to COVID-19.
Okay. I mean, I was going to say we're still
Now,
trying
it's
to develop
indirectly
that.
related to COVID-19, though.
And why do they think people are not getting their shots that they normally would be getting? Is that just avoiding going to the hospital?
You know, it really is. So people follow the recommendations laid out by the government and doctors way too well in the very beginning, and they were staying at home.
Got it.
And they were sheltering in place, and they weren't going to the doctor's office for non-essential reasons. But we have to reverse that.
Sorry, I'm ending you. All right, we are now able to bring you even more content now that we have this platform at 3 every day. That means we get more from our special correspondent, Dr. Alok Patel. He's part of our coronavirus team of experts, and he's talking directly to you in a segment we're calling Doctor's Note.
In the past week, both a frontline physician and an EMT took their own lives. Police officers are reporting an increase in domestic violence and child abuse cases. Alcohol sales are up, as are stress levels and feelings of depression and hopelessness. I'm Dr. Alok Patel, and on today's Doctor's Note, let's chat mental illness, the epidemic that may rise even as the coronavirus curve flattens. Healthcare workers are working to exhaustion with constrained resources and risking their own lives. Workers in the food industry, transportation, or all the daily services that keep the world running are also worried about their own exposure or getting their families sick. Then there's millions of people who have lost their jobs, people who are stuck in abusive households, and kids and teens who aren't able to connect with their peers. It serves no surprise that large-scale disasters and pandemics are a horrific recipe for anxiety, depression, stress, or PTSD. So here's where we need to be proactive. There's a lot we can do for one another. Outreach to anyone who may be struggling right now can make a huge difference, even if it's a simple check-in phone call or a Zoom date. Businesses, gyms, and offices should continue the virtual meetups. Also, all of us, including children, need structure, so try to keep a routine schedule, a regular bedtime, and whenever you can, squeeze in time for a physically distanced workout. And hopefully, there will be more resources for counseling and intervention, because psychiatrists, social workers, and therapists deserve everything they need to be able to make virtual appointments. And for anyone who may be living in an abusive home, there has to be a safe, socially distanced alternative. Now, fortunately, there are some hotlines and online resources that are available right now for anyone who may need them. COVIDmentalhealthsupport.org is a searchable database of crisis services that can help people with anything from anxiety to trouble parenting to depression. The National Domestic Violence Hotline has trained experts that are able to talk to anyone confidentially 24/7. There's also the National Helpline for Substance Abuse. There's a crisis text line where you can text HOME to 741-741 and reach your crisis counselor. And everyone should know about the National Suicide Prevention Lifeline, which can be the difference of life or death for someone who's having a suicidal crisis or under extreme emotional distress. There are options out there, but we need more. We need to raise awareness when it comes to the second curve we're going to have to flatten, the one built on mental illness. Because right now, no one should feel alone. We're going to get through this together.
For sure, the emotional health aspect is so important as well. So if you can, do something nice for somebody virtually, or maybe drop off a little food, something like that. I want to let you know, speaking of food, this coming Tuesday, Governor Newsom will give some guidelines for the reopening of restaurants in phase 2. It's not going to be dining as you knew it before. There will be changes, but we're eager to hear what his suggestions will be. And of course, every weekday at 3 o'clock, we'll be right here to get answers for you from our experts. Thanks a lot for joining us. Bye-bye.